The Africa Center for Disease Control and Prevention is coordinating the continent's COVID-19 vaccine procurement program. More than 200 million doses have been pre-ordered for the African member countries, with many going for the Pfizer vaccines. The head of the continent's health organization recommended how member countries should handle the vaccines distribution and administration process. Let's have more details of that in this report.
Africa has already announced it's preparing to purchase 270 million doses of vaccines, and that process is now being coordinated by the Africa Cdc under what is known as the Continental Medical Supplies Platform. John Nkengasong, the Africa Cdc Director General, says all is going according to plan.
I'm pleased to announce that the pre-order process has started with member states. I think several member states, I can give you the exact number because they keep changing, are now engaged with a platform that is the African Medical Supply Platform to place their orders.
Many African countries will go for the Pfizer vaccine, which requires a minus 70 degrees Celsius of storage. So going ahead, the Africa CDC has suggested how member states should handle the vaccination transportation and administration process with an example.
If one was to make available the Pfizer vaccine to me and said, administer it in Ethiopia, what will I do? I mean, I'll do the simple things. But one, all we need to do is to get the vaccines to the port, the airport in Addis Ababa. And Ethiopian Airlines, Kenya Airlines, and others are now equipped to transport vaccines at ultra cold chain requirement. Then from there, the second thing you do is to create a vaccination coordinating unit at the Ethiopian Public Health Institute, where they already have cold chains there. They have series of minus 70s there. They can, and liquid nitrogen tanks. So that shouldn't be a problem. So there, I take my vaccines from the airport, store them at the EPHI, the Ethiopian Public Health Institute. The third thing we need to do now will be to create vaccination points across Addis Ababa.
Dr. Nkengasong says that if the training of health workers on vaccine administration and public mobilization can be implemented well, this can guarantee a successful vaccination of millions in a mega city within a short period. In Africa, 3.3 million COVID-19 cases have been reported so far. That is 3.5% of the total cases reported globally. Of that number, 83% have recovered, and 81,000 COVID-19 related deaths have been reported across the continent. That is about 4% of deaths reported globally. Still, experts say Africa must continue its works of prevention and management until it comfortably secures enough vaccinations.
The Africa Center for Disease Control there, of course, orders COVID-19 vaccines for member countries as the number of COVID-19 cases continue to rise in the continent.